Hello, welcome to our Rural InReach broadcast today. My name's Sarah and I work as a project officer for the Rural InReach program, and today we're talking about hearing with confidence with the Ear Science Institute. So the panellists today are Joanne and Lize and Sharon. If you guys can just tell me a little bit more about yourselves and what your role is with the Institute.
Thanks. My name's Sharon Safstrom and I'm the Community Program Coordinator for the Ear Science Institute Australia. I also am a hearing aid wearer, and I've been wearing hearing aids for around 20 years now, so I have a really clear understanding of what it's like for people to have a hearing loss, as well as the community impact of what that hearing loss is.
My name is Lize Strachen. I'm an audiologist at the Lions Hearing Clinics at the Ear Science Institute. I mainly specialise in adult rehabilitation and paediatric testing.
Hi, my name's Joanne Sarthel. I'm actually a clinical audiologist working at Lions Hearing at the Ear Science Institute. I specialise with adult rehabilitation as well as with implantable technologies.
That's great, thanks so much, and thanks for being with us today.
Great, thanks for having us.
So can you tell me a little bit more about the Ear Science Institute and the Lions Hearing Clinic as well?
Yeah, the Ear Science Institute is a centre of excellence for ear and hearing disorders. It has four main pillars. There's research, there's clinical education, which is through the Advanced Centre, there's clinical services, which is the Lions Hearing Clinics and also the Ear Science Institute Implant Centre, and there's community services as well.
Fabulous. So what services do you offer in those clinics?
The Lions Hearing Clinics specifically offer services to adults and children for ear and hearing. So we offer things like hearing tests for adults and children. We fit hearing aids and offer rehabilitation programs for adults. Tinnitus services, as well as some other assistive devices, anything to do with ears and hearing. Yeah. There's also the ESIA Implant Centre under clinical, and they fit implantable devices. So where hearing aids don't work, there's specific criteria for implantable devices, and you can go to the ESIA Implant Centre for that.
And where can we go to get more information about hearing and about the Institute?
The best place to start is always our website. We have a really comprehensive website that covers all of those different areas of the Ear Science Institute. So from clinical to research to community education and to education and training. So the best place to go is our Ear Science Institute Australia website.
Thanks for that, Sharon. So we're going to move on now and talk about the impact of hearing loss. So what behaviours will we normally see in someone who's suffering from some hearing loss?
So hearing loss is quite tricky, and I'll talk about what I see when I'm out in the community, but also myself as well. Hearing loss means not that we can't hear what's being said, but it means that we can't understand the words, and that's where it gets really tricky. So going out and doing the things you would normally do every day, your social activities, your things at work, with friends and family, it means you have trouble understanding the words that are being said, and that's what you find is really difficult. So it may be sometimes people withdraw from those activities, so they'll stop going to them, and they might be things that mean a lot to people and that are really important in their lives. So by stopping going to family events or to community activities, so a book club or a quilting group or anything they really like to do, means they're then becoming isolated, which it's those behaviours that we're missing out, people are missing out. And that's what's really
withdraw.
Yeah, they withdraw, because if you can't understand the words, how can you be part of the conversation?
So true.
And that's what's really difficult. And hearing aids can help, but even with people that don't have hearing aids or may not know they've got a hearing loss, that communication and that impact of not being able to communicate really well is really, really hard. And it's hard on the person and on their families.
Yeah. Can you talk a little bit more about that? What impact can it have on someone's friends and their family?
So imagine if you're having a conversation with someone and they didn't understand the words that you were saying. And they might ask you to repeat, and they might ask you to say it again, and they might ask you to say it again. And that can be frustrating for the person that's trying to say something, and also for the person that's trying to understand what's being said. So you add in, they're frustrated and you're frustrated, and there can be a real added tension.
And I think sometimes with hearing loss, if somebody is in a wheelchair, it's quite easy to help them. You push their wheelchair or you can open a door for them. But with hearing loss, people don't know how to help. People don't know what to do. So that makes it quite hard. So maybe even if you want to help, you can't because you don't know how. It's not so obvious.
And I think that's a really good point, Lize. It's not obvious. So I wear hearing aids, but it's not obvious that you can see them. So it really is a hidden disability because you can't see whether someone has a hearing loss, like if you wore glasses. And even if they have hearing aids, then it's still difficult to, people don't really notice that you have hearing aids. Kids normally do, lots of kids do, and other people that wear hearing aids do, but other people don't. So how do you know to make the adjustments in how you communicate? So background less background noise and facing them really clearly. If you don't know they've got a hearing loss, so it's really tricky. And
so and it can cause confusion as well when somebody talking to you from behind. Well, why is Sharon not responding? Is she rude? Is she arrogant? Is she not wanting to talk to me? No, she just can't hear you because you're standing behind her. So that could be quite a
Sounds like
big
there's lots of layers to it. It's quite a complex
there is,
problem.
and it's not just the person that has the loss, it's their family and their friends and their children, you know, and grandchildren. They want to understand what your grandchildren are saying, and your grandkids want grandparents to understand what they're saying. So that communication and there's a really big impact on all
Sounds like
those
it
people.
can be really frustrating for everyone involved.
I think it can.
So let's move on now to talk about more the science of hearing loss. So how do we hear? Can you explain a little bit about how hearing actually works?
Okay, so what I've done is I've sort of brought a picture along just to make it a bit easier to explain. So firstly, I'll show you just sort of how the parts of the ear. You might know the parts of the ear, but knowing all the parts really allows you to understand how we actually hear. So firstly, we've got what we call the pinna, or just the outside of the ear as you can see it. Then we have the ear canal. Then you have the eardrum. Then you have the middle ear cavity, which has 3 little bones in, the malleus, incus and stapes. And then you have the hearing organ, or the cochlea, and then the nerve that goes up to the brain. So when sound comes in, the sound vibrations, they come in, they channel through the ear canal, they vibrate the eardrum. That vibration is passed on to the 3 little bones in the middle ear, and then that vibration is passed on to the fluid in the actual hearing organ, or the cochlea. The hair cells in the hearing organ responds to those vibrations, and the sound is sent up to the brain through the hearing nerve.
And just to add as well, an interesting fact, the cochlea is as small as a garden pea. So the peas that we eat, that's how tiny it is. And that's obviously your main organ of hearing. So it's just fantastic, you know, when you think about the things that they can do, when you think about cochlear implants and, you know, a whole lot of other things that can be done, and the surgery that's done on the cochlea itself. It's just fantastic.
That's a very interesting point.
So what are the types of hearing loss? I know there's a couple of different types.
There are. So these 3 main types of hearing losses. So firstly, you get your conductive hearing loss. The conductive hearing loss is when you have a hearing loss or when you have a blockage or obstruction in either the sort of somewhere in, you know, the outer ear or the pinna, or in the ear canal, or any blockages or damage to the middle ear area. Usually a conductive hearing loss is something that could be rectified or improved through medical intervention. Then you have your sensory neural hearing loss, when the hearing loss is more permanent and the damage is in the actual hearing organ or the nerve after the hearing organ, the nerve going up to the brain. There's also the mixed hearing loss, which is the 3rd type of hearing loss, and that's when you have a hearing loss in either the outer ear and middle ear and the inner ear. So it's a combination of the conductive and sensory neural hearing loss. And an interesting fact is that Sharon actually has a mixed hearing loss. So in her case, she has some ossification or some hardening of the bones in the middle ear, and there's some hearing loss in the hearing organ. So she's got a loss in the sort of the middle ear and the inner ear, or the cochlea.
Okay. So that's really interesting. So it's not necessarily just one or the other. It can be
it can be both. And our testing that we do can actually determine what type of hearing loss it is, one of those 3.
Okay, fantastic. Can you please tell me how a little bit it's measured, so how you do that testing and what the process is?
So when you come in to an audiologist and to have a hearing test done, firstly we take a very detailed history to get an understanding of what your hearing concerns are, what your hearing loss is, what the history is, how much, you know, have you had surgery, has it been there since birth, what's your lifestyle, so where are you having trouble hearing? Based on that information, we can make appropriate referrals after the assessment, and also it allows us to develop a rehabilitation program for you, and that's what Jo will speak about later, because your needs are something that we need to incorporate in your rehabilitation program. We then do otoscopy. This is where we use a light to have a look in your ear to see if there's any obstructions in the ear canal, and we also look at the health of the eardrum. We then do tympanometry. What that essentially is we're looking at the mobility of the eardrum. Now that you know how we hear, so when sound comes in, it has to vibrate the eardrum to transfer the sounds through to the actual hearing organ. So we need the eardrum to move well and effectively. So that's a test to allow us to determine, is the eardrum moving effectively, or is there any blockages or obstruction, stopping it from moving. We then go on to the hearing test, and firstly we test the whole auditory pathway, so from the outer ear right into the inner ear. And that's when we put headphones over the ear. Like I said, it tests the whole auditory pathway. We then do bone conduction, where we put a little thing just behind your ear. The sound is then then vibrates the skull and then vibrates the hearing organ directly, the cochlea. So the part that Jo also mentioned before, it's actually enclosed in bone. So it vibrates the cochlea directly. And with the headphones and the bone conduction test, we're able to determine, is the hearing loss sensory neural, so just in the cochlea, or is it somewhere along the way, maybe a conductive or then the mixed hearing loss. We then do speech testing, and speech testing is very, very important test for us to determine, is firstly the hearing test that we've done consistent, is it accurate? Based on the hearing test, we able to assess, well, how well is this person able to understand speech? So if they're inconsistent, we can move from there. If they're consistent, we know our results are reliable. But it also allows us to determine, is this person able to understand speech? So when we speak to them or when we give them hearing aids or other devices, are they able to make any sense from it?
And that can be one of the most important things, can't it?
Exactly.
Understanding speech.
That's what you said at the start. That's what we want to hear. So we want to know, are you able to understand speech? Because some people's hearing loss might show that you can understand speech, or that level of hearing will allow you to understand it. But when we do the speech test, we're not. If we get anything like that, that's when we refer you on to the implant centre, where they do a lot more comprehensive speech assessments to actually see where your deficiencies are and what other maybe implantable technologies will be able to overcome those speech difficulties.
Okay, that's great. A lot of information.
Yeah, a lot of information. So it's a very comprehensive test, and that's what we hear from everybody that comes in. They always say, it's very thorough, because we really do a lot, because we want to make sure that our rehabilitation, which Jo is going to talk about, is right for you.
And it's really tailored, isn't it, to the person's
it's
lifestyle
not,
and needs.
Not a one-size-fit-all. So we're really able to determine where to go next.
And just like a quick recap, because I do agree it is a lot of information to take in. I guess the key points to remember is that the ear is actually made up of 3 parts. So we've got the outer ear, the middle ear, and the inner ear. And when we do the tests for you, we're actually checking to see exactly where the problem is. And at the same time, the test, if you just think about it, there's just 2 main parts to it. So there's one part where you'll actually hear a whole lot of beeps, that's where you'll have to let the person know, how loud the sound is. And then the second part of the test is where you'll hear some words. And that second part of the test is really, really important, as Sharon and Lisa both mentioned, because that's really going to give you an idea, a true reflection of how you really communicate in everyday life, because the reality is we don't exactly hear beeps the whole day. We hear speech. Definitely. So just in a nutshell, I think that will be the most important parts.
Yeah, that's great. It's a great summary. So you hear lots of rumours about things that can contribute to hearing loss, but what are some of the causes?
So I think a very important point to start with is to tell you that hearing loss is the most frequently identified condition in newborn children, with 9 to 12 out of every 10,000 children born having a hearing loss that will affect their speech and language development. So you can see the impact that that will have on the community as a whole. If you look at Australia just in general, 1 in 5 people have a hearing loss. And when you look at people over 65 years of age, 1 in 2 people actually have hearing loss. So the impact of hearing loss is really significant, and that's why things like this is so important, to get them, get the message out there.
Definitely.
But then, what are the causes of hearing loss? So firstly, you get your hearing loss that's present at birth, and that's what we call a congenital hearing loss. So when you're born, you have that hearing loss. Then you can get an acquired hearing loss. So a hearing loss that either occurs, or occurs at any point in your life. It could be, when you are a toddler or when you're a baby, it can be acquired quite fast, or at old age, or anywhere in between. And then how I like to explain the causes of hearing losses, we'll come back to the 3 types of hearing losses. So you've got your conductive and sensory neural hearing loss and your mixed hearing loss. So conductive hearing loss, and we've sort of covered that already a little bit, but it's always good to recap these things. A blockage or damage in either the outer ear or the middle ear. It's usually a transient condition that can be rectified through medical intervention like medications or surgery. It usually is not permanent. In most cases, it's not permanent. Something as simple as wax, which is completely a normal process of the ear, and it actually has protective mechanisms in the ear, can start accumulating in the ear, especially with people with hearing aids. It actually, makes the wax build up because it's not able to have its natural process of moving out of the ear. So if the wax builds up, that can cause a hearing loss. And that's quite easily addressed with oily drops. You can even just use olive oil, or you have to have it syringed by your GP or removed by an ear, nose and throat specialist. Then you have a eustachian tube dysfunction, which is more commonly in children. And firstly, I'll explain what your eustachian tube is. So it's the tube that connects the ear to the back of your throat, okay? So if that tube in a normal process just opens and closes when you sort of open your mouth, when you chew, and we need that tube to function well so that the pressure inside your head is the same as outside your head. If the tube doesn't work effectively, you get a negative pressure in that middle ear cavity.
Sorry, and Lisa, just to add,
Yeah.
it's like, when you're actually going up on a
I was just
plane,
gonna say, yeah,
you have that popping sensation,
when your
that's
ear
the
sort of
tube.
just shut, up a hill or down a hill.
Yeah.
And that itself may cause a bit of a hearing loss, sort of a mild conductive hearing loss, but that can lead on to sort of a lead up to fluid in the middle ear, which we call is otitis media, or what most people know as glue ear. So that can, a bacterial or viral agent can affect the middle ear, and that fluid buildup, I guess it creates a pressure in the middle ear, which might perforate or make a hole in the eardrum to relieve that pressure. That itself can cause a conductive hearing loss as well. Also, a conductive hearing loss can be caused, and in Sharon's case, by the 3 little bones in the middle ear not functioning quite as well as what they should. So in Sharon's case, is they've ossified or hardened, so they're not transferring all the sound through to the hearing nerve. Also, something that can happen, the bones are sort of like an elbow joint and a wrist joint. They can dislocate. So then some of that vibration is not passed on to the actual hearing organ, to the fluid in the hearing organ. So some of the sound can be lost there. Sensory neural hearing loss, so hearing loss in the actual hearing organ, that is caused by malformation of the actual hearing organ or death of the hair cells inside the hearing organ. It can either result of excessive noise exposure, exposure to ototoxic drugs, which could be given to you as part of cancer treatment, medications, or just long-term wear and tear that you get with age, and that's what we call presbycusis. Hearing loss can also result in the nerve that goes from the hearing organ up to the brain, and that's why it's called the sensory neural. So the neural damage there. Yeah.
Okay.
And then a mixed loss is all of the above sort of combined. Yeah.
Okay. So if I think that I've got one or a few of these things going on, where do I start? How do I access your services?
I think being remote is always very, very hard to come by hearing services in general, you know, and so we need to think sort of, I think, outside of the square. It's quite easy for me to tell you what to do when you're in Perth. I'll give you the phone number and you can call. It's nice and easy. But when you are far away from Perth, it can be hard to obtain the services that you need. I think the first place that I would recommend you go is to your GP or your health nurse, because they are often aware of hearing services in your area. So they can let you know if there are services that come up, you know, weekly, monthly, or there might be a permanent person that you are not aware of. A lot of health nurses are actually trained as well to do baseline testing. So they don't do the comprehensive test that we spoke about before, but they can do a quick test which can give you an idea of where your hearing is at and then direct you, you know, in sort of to the right person or place. Further, your GP or health nurse can look at any medical things going wrong, you know, any medical causes to your hearing loss. So something as basic as wax, so they can remove the wax and get you ready for the test. They can maybe see you might have an ear infection, so they can address that ear infection with antibiotics, or some GPs just wait and see if it heals. But so that you don't, you know, come to us, have an infection, and then we have to get you back into us again. So they can deal with all the medical things first. Also, the GP is able to complete an application form for you where you can get free hearing service through the government program. So that's a really good place to start. So if you are on an Australian pension or a DVA card, you can actually get free, all your hearing services for free once you have the voucher from the government. So the GP can initiate all of that. We also have our Lions Hearing Bus, which goes around to many towns, to regional shows, and they do free hearing tests for anybody that attends the bus. And that, you know, it's a basic hearing test and a basic history, but it is fantastic to show you, where can I go next? Do I have a hearing loss? Well, no, so then you can go on. Or, sorry Sharon, I'll just really say this, and you know, or they might say, yes, definitely there's a hearing loss, or there's wax, and they can direct you in the right person, so you're not wasting your time going to the wrong people.
It's a really, it's a safe place to go, the hearing bus as well. It comes to you and you can just pop in and have your hearing tested, and they can then give you all the information about what to do. And they know all of the different services that are around. They can give you all the information of where to go next. So it indicates if there's a concern, where to go and what to do.
Where to go, definitely. And then, like Sharon mentioned right at the start, our website is, you know, a wealth of information. So you can really go there, and many of your questions could be answered just on the website. So it might not be that you want to come in for a hearing test, but you might just have some questions about your hearing, or your mum's hearing, or your sister's hearing, or something like that that you want to have a look at. So that's definitely, you might, you know, many of your questions could be answered.
And there is an online hearing screening tool on our website as well, so that could give you that, again, like the hearing bus, just that beginning place to start of, is there a concern, and maybe I should start thinking about doing something about this.
Definitely. And you can also use the website to ask questions, which then get sent through to sort of a communal email address, and then those are passed on to the relevant people. So an actual audiologist might be able to answer your specific questions, and you can use the website as well to book an appointment. And that brings us to the next point, which is coming into Lions Hearing Clinics, you know, for a full diagnostic test. So you can book those appointments online, or you can call us. And because we have the 7 clinics across Perth, we can be quite flexible. If you're coming into Perth for work or for a holiday, it's quite easy for us to fit you in and work around your flight schedule or your work schedule, and fit you in and see you there for a full test.
And what's the cost associated with that?
So for a full audiological assessment for an adult, if you're not on the Australian government program, it's $98 for an assessment.
Okay.
Yeah.
All
So
right,
that
so it's quite affordable.
all that,
It's not too
yeah,
bad. Yeah.
Exactly what we spoke about before. You know, the full detailed history in which
Yes.
Joe recapped on all of that for 98.
Okay.
Yeah. So it's really good. Yeah. And then we also write a report to the relevant people, so we can write a report to the implant centre or to your GP.
Okay, that's great. Thank you for that
Fantastic.
information. So we're going to move on to talk to Joe now about adult hearing aids and rehabilitation. So Joe, how do I know if a hearing aid is the right option for me?
Okay. First of all, hearing aids is just one of the many options that the audiologist will actually explore once a hearing loss is identified. But I must agree, it's definitely getting very popular, largely because it is getting very discreet and because of the advances with hearing aid technology. But back to your question about how do you know if it is the right option for you? I guess it depends on a number of factors. So the first thing that you would need to look at is, are there any medical contraindications to using a hearing aid? Now, an audiologist, after they do that full assessment that Lisa described to us a few minutes ago, will have a look at your results. They'll review your results, and then based on your results, they'll decide whether or not they need to seek medical clearance. Now, if they need medical clearance, then they might refer you on maybe to an ear, nose and throat specialist, or maybe to your GP as well. Now, the other factor that you need to look at would be the type and severity of the hearing loss that you may present with. Some people might have a very mild hearing loss, or some people might have a profound hearing loss. So based on the severity, you know, one can then decide whether or not a hearing aid would be beneficial to you. So if we do come to a situation where a hearing aid is not beneficial, then the audiologist will then discuss with you other rehabilitation options and then make the adequate referrals to perhaps maybe the implant centre. Now, the implant centre works with exciting devices or implants such as the Baha device. That's actually a bone-anchored hearing aid, as well as the cochlear implant. Those are just two of the many devices they work with. So if we move now to the other end of the spectrum, where the hearing loss is just a mild hearing loss, but the client comes in and maybe you're feeling like, oh, I'm really struggling to hear on the telephone, or I'm really struggling to hear the television better, then the audiologist might also look at other options for you, something called assistive listening devices. And as the name suggests, these devices actually help you to hear better in certain contexts. So maybe it might be having a telephone amplifier to help you hear better on the telephone, or maybe it might be having a TV headset, for example, to make the sounds from the television a lot more amplified for you. So there are so many options available to you once a hearing loss is identified, and that's why it's really good to come in and speak to your audiologist so that they can actually have a look at your situation and decide which option is going to be the best for you.
And there might be more than one option. You know, you might have a hearing
sounds
aid
like
and
it.
assistive listening device.
Yes.
Which, yeah.
I often do. I wear hearing aids, and I have, especially for the television and on the phone, because I find those things still quite difficult.
Yeah.
So I have Bluetooth device that's connected up to my television and to my phone, which means I can hear both of those things really clearly, which makes a really big difference in my life. Yeah.
So if you've got hearing loss in both ears, is it okay just to use one hearing aid?
Well, a lot of people sometimes come in and they would like to use just one hearing aid. But the reality is that it's actually good to have two hearing aids. Now, there's a few reasons for it. One is that having two hearing aids when you have a hearing loss in both ears will obviously offer you greater balance of hearing, and that's obviously quite important. Apart from that, it will also help you to localize sounds a lot better. So what that means is that you'll be able to identify which side a sound is coming from. So for example, if Sharon is sitting here on this side, and if you have a hearing aid on the opposite side, you may not know, oh, is she calling you from the right or the left? But with the hearing aid on both sides, you will be able to adequately localize exactly where that sound is coming from. And apart from that, there's been a lot of research in the field, and it does show that people that actually use two hearing aids tend to perform better in background noise. Now, one of the main concerns that many people with a hearing loss come in with is they say that when they are in background noise they have difficulty hearing, and Sharon would agree with that. Yeah. Yep. So definitely having 2 hearing aids in that situation as well is going to give you better results.
Okay, so if I've got a hearing aid, what can I do to get the most out of that?
Okay, well, there's a few things that you can do. One of the most important things is to make sure that you come in for a hearing test on an annual basis. Now, when you do come in for a hearing test, what we would do is have a look at your hearing loss. So we'll be able to monitor your levels, but at the same time, we will be able to fine-tune your hearing aid for you, so that if your hearing loss changes, we'll then be able to change your settings on your hearing aids. Other things that you would need to do is just do daily maintenance checks on your hearing aids, because that's really important, isn't it?
It makes a really big difference.
And yeah, because it's little things like, you know, making sure that the wax filters are changed, because that can really impact on the sound quality of your hearing aid. Because if you have a hearing aid that has maybe wax in the wax filter, the microphone will sound very crackly, and you would have a very distorted sound quality. So it's important to look at things like that. Other things that you can do with your hearing aids is definitely use a dry aid kit. Now, a lot of the manufacturers do recommend using a dry aid kit every night, because what it does do is it takes away all the moisture from your hearing aid. And people who generally use the dry aid kit tend to have fewer issues with repairs and problems down the track. So yeah, those are just a few things that you can do.
I think too, Jo, what's really important, if someone's having trouble still, like they've had the hearing aids fitted and they're still having trouble, say, with their voice, or I know for me when I got some sounds were too loud. For me, paper was too loud.
Yeah, yeah.
So if something's a bit too loud or a bit too soft, to go back to your audiologist and let them know what you're still having trouble with. I think it's really important, because they just turn paper down, and that could be a voice, it could be something in your life you're still struggling with, or a situation that you find difficult still, so in noise or different scenarios, and let them know. And it can be that they can make those changes to the programming, that you can still it can improve that hearing aid experience.
Yeah, and you've actually brought up a very important point, the fact that when you actually come in to have a hearing aid fitting, it's not just one appointment. We don't just put a standard setting on the hearing aid and off you go. It is such an interactive process, because you'll be coming in to see us for a number of appointments. And the best thing about it is that you do actually have that hearing aid trial. So you have that opportunity now to use that hearing aid and to use it in your everyday listening environments. So whether it is using it at home or using it in the work environment, and you can come back in and give us some feedback. The feedback that you give us is just so important, because that really does guide how we can actually fine-tune the hearing aid well for you. And we rely quite heavily on your feedback. So, you know, it's really a very interactive process, and it's an ongoing process as well.
Because it can take a little while to get used to wearing them.
Yes.
It's not just you put them in and they work perfectly first time. And they certainly improve things straight away, but it can take a little while. And I think it is and we'll talk about it in a minute, for the brain to catch up. And just to get used to hearing all those sounds again.
Research has shown that it takes 6 months for people to get used to hearing aids. You know, so it's so important, that first part.
To have,
And I was going to say as well, especially in this setting, because people that are, you know, that are in remote Australia aren't maybe able to come in for as many appointments as us audiologists might like. And newer hearing aids actually now have a feature in, if you have a remote control, the audiologist sets the hearing aid up. But if you feel, for example, the hearing aid is too loud in a noisy environment, you can adjust the volume on the hearing aid, and you can tell the hearing aid that this is what you prefer, and it will slowly adapt how it amplifies over time to accommodate for that. It's not always the best feature, but definitely if you aren't able to come in for your appointments, you know, the audiologist can discuss something like that with you as well, which can be really handy.
And it's really fantastic. There's been amazing developments in the hearing aid industry, like what she's talking about now, the auto acclimatization process, but there's so many other features, you know, like just I just saw a client the other day, and he enjoys water sports and sailing, and now you can even get hearing aids that actually have water resistant features. And you know, it's just fantastic how far they've actually come. They're no longer the big and bulky devices that they were in the past.
Yeah.
They're a lot more discreet and so much more better.
Just on that note,
Yeah.
is there maybe a reason why people don't like wearing hearing aids? Do you get a lot of resistance to wearing them?
Yeah, I guess it depends, you know, at what stage the person comes in and sees you. But certainly there are many reasons for people won't use hearing aids. I guess one issue would be the cosmetic reasons. People may be afraid or shy away from actually using a hearing aid. But I think in recent times, given the evolution of the hearing aid styles, I mean, now you can get hearing aids on the market which they regard as being invisible hearing aids. So given that evolution with regards to the hearing aid styles, most people are definitely a lot more open to trying hearing aids out these days. The other main factor that would actually impact on whether or not a person uses a hearing aid would definitely be unrealistic expectations. I've had a few clients that have come in, they've put their hearing aids in, they go out and maybe go out to a restaurant or you know, places that they're having difficulty in, and they come back disappointed because they think, oh, why am I still asking that person to repeat what they've actually said? Sometimes people may have this misconception that once they have their hearing aids in, they'll be able to hear perfectly normal.
Yep.
But the reality is it's not the case. It does not work that way. Hearing aids do help to a certain extent, but you do need to supplement your hearing with other activities or strategies or tactics, such as looking at the person when you're talking to them, you know, and also, you know, looking at where you're seated in terms of, you know, a table. So there are lots of other things that you would need to do. So those are just probably the two, I would think, the main categories. But can you think of anything else anything else?
The main one that I guess I experience and I see when I'm running groups is if you want someone to understand you and they have a hearing loss, they need to be able to see your face. They need to be able to see your mouth, and you need to minimise background noise. And if those two things happen, and if you can choose to have the noise behind you, behind the person with a hearing loss, it makes such a difference, just such a difference. Yeah.
Just on that note, what can family and friends do to help someone if they've got a hearing loss? Is those kind of strategies like looking at them and, you know, looking at them when you talk to them? And
I personally feel that the most powerful thing a person could do if they have a hearing loss is actually share with their family and friends that they do have a hearing loss.
I agree.
You know, lots of the times people may have a hearing loss, but they're so afraid to let the other person know. So there has to be some degree of assertiveness once you have a hearing loss. I think that's really important. And I think that once the family are aware that you have a hearing loss, they can actually look at implementing different strategies. So one of the things that is important, or things that actually help a person, is, as you mentioned before, is actually looking at the person when you are talking to them. The other thing is sometimes people may have this misconception that if they speak loudly to you, or perhaps shout at you, that would actually help you to hear better, but that's not necessarily the case. Most often it's just generally speaking clearly to the person that would actually help, and speaking at a good rate so that they can follow the conversation with you. Another factor is actually just being aware of things such as room acoustics. So if, for example, you're actually booking out to go to a restaurant for someone's party, or, you know, a friend's birthday, or anything really, try and book in a restaurant, if possible, that has good acoustics. So what does that mean really? It means looking at a place that perhaps has soft furnishings in it. So an example of a place that would have poor acoustics would be for example, a place with high ceilings, hard surfaces, wooden floors. Because what happens there is that the sound is actually reflected off these hard surfaces, so you actually tend to get a lot of echo and a lot of reverberation. Now, even someone with normal hearing is going to struggle to hear in that sort of environment. But if you can take the necessary steps and, you know, perhaps maybe book for dinner when it's not so quiet and not so busy. Things like that, you know, and would obviously make a difference.
Okay, thanks for that, Jo. That's great. Can we talk a little bit now about what the role of the brain is in hearing and listening?
Yeah, I guess first of all, I think the main thing is actually to distinguish between hearing versus listening. So hearing, in essence, is a very passive process. So you don't necessarily have to be alert or even concentrate when you are actually hearing. So, for example, you might be asleep and you would still be able to hear, you know, the window break, for example. But listening, on the other hand, is actually a very conscious process. It is very active. It involves an active interaction where you need to actually focus on what you're listening to and focus on it and give it that attention, concentrate to it. Now, sometimes when people have hearing aids, or shall I say hearing aids in general, they do actually help with issues such as speech clarity, localization, so that's knowing where the sound is actually coming from, and also with improving speech from a distance. But the hearing aid, however, is not going to help in situations where one actually has problems with memory or maybe attention issues or just processing abilities of an individual. So it's very important to be aware of that so that you can actually have realistic expectations with a hearing aid.
Thanks for that, Jo. That information was great. So we're going to go back to Sharon now, and she's going to talk a little bit about Hearing Awareness Week, which is coming up soon.
Thank you. At the end of August, the last week in August every year, it's National Hearing Awareness Week. This year, the Ear Science Institute Australia is providing free seminars. So at our locations in Subiaco, Winthrop and Joondalup, we're providing for the whole week in Subiaco and a day each in Joondalup and Winthrop, free information sessions about all sorts of different topics around hearing. So from identifying hearing loss to tinnitus, to balance, to resources for hearing impaired, for pensioners.
Yeah, the pensioner program, which is always
how to get more out of hearing aids. So they're run at the last week in August. The week after that, in September, we're also running some additional seminars for people to access that are in regional remote areas, and we're calling this Extending the Boundaries. This will be run through the community resource centres that are close to you, and they will be also available live on the Ear Science Institute Australia's website. So if you'd like more information about any of the topics that we talked about today, also about Hearing Awareness Week, the free seminars the last week of August, or our Extending the Boundaries seminars, then please go to our website. So it's the Ear Science website, the Ear Science Institute Australia.
That's great. Thanks so much for that, Sharon.
And do you want to cover the bus locations as well?
Yes, sorry.
Yes.
The Lions Hearing Bus is owned by the Lions Hearing Foundation, and it's also, we support the Lions Hearing Bus as well at the Ear Science Institute Australia, and all the bus locations can be found on the Ear Science Institute Australia's website as well.
That's great. Thank you so much for that. So just wanted to thank all of our panel members today. You guys have brought with you a wealth of knowledge, and it's been really fantastic. If you'd like any more information, the website is available, the Ear Science Institute website, and also the Lions Hearing website as well. So just to talk a little bit about the program that I work for, it's the Rural InReach program, and we provide health and wellbeing support to rural and regional Western Australia, and that's done through online technologies and video conferencing. And the number to call us if you'd like any more information about that program is on your screen now. So thanks again for joining us today, and we're really hoping to see you again next time.